The Canadian Health Coalition is a proud supporter and advocate for the public collection of blood and blood products. We continue to have conversations with health ministers, federally, provincially, and territorially, about the need to expand public collection of plasma services in Canada by Canadian Blood Services. And we're pleased that Canadian Blood Services has a plan to increase their collection of blood products. We have a few areas of concern that remain. We hear from youth across the country that they are not familiar with Canadian Blood Services or blood plasma donation or the One Match system. We believe CBS could do much more to promote your services and your clinics. Saskatchewan Canadian Blood Services Clinic has seen a decline in donors aged 17 to 24, while Canadian Plasma Resources is aggressively campaigning to that age cohort with advertisements on University of Saskatchewan campus and on public transportation, popular locations for youth and students. We believe CBS needs to work hard at making their brand more familiar to youth and all of your services more accessible and visible. We'd like to see CBS take a strong advocacy role for the public collection of blood, plasma, the One Match system, organ donation, and cord blood. The public needs to know more about your services that you offer and the ways that they can participate. We are concerned about the correspondence released through the Freedom of Information reports that Maclean used in their article. While CBS did advocate for the continuation of non-remunerated blood collection and indicated that the World Health Organization advises that blood should only be donated by voluntary sources, CBS did not do the same for plasma and instead only raised issues on the clarity of messaging of safety of paid donor plasma. This is despite the guidelines by the World Health Organization, the advice of many international organizations, and the Crever Commission, who continue to recommend that plasma be collected by voluntary, non-remunerated means only. We are pleased that you have since begun to raise concerns about the two-tiered plasma collection system and its current and potential impacts on the publicly funded Canadian Blood Service collection of non-remunerated plasma. It's a lot of technical speak. However, we do not believe enough has been done to inform the public of this threat. While CBS produced online videos claiming that the two-tiered system could exist with no negative impact on the public system, you've not produced videos stating your new conclusion that there could be a negative impact on the public system, and in fact, there already has been a decline in ages of donors 17 to 24. There was one public statement made to the media in New Brunswick last year. Otherwise, we believe the public continues to be unaware of the harm that is being caused by the private for-profit clinics regarding the security of Canada's plasma supply. We'd like CBS to join us in calling for an annual day of commemoration on Parliament Hill for the victims and survivors of the tainted blood crisis. This history cannot be forgotten. As an organization who was born out of the tainted blood tragedy and works to protect our system and patients, we believe you're well positioned to suggest such an annual day, parliamentary day, which recognizes the crisis, its victims, and its survivors, so our government leaders and policymakers are aware of this unfortunate past and understand the importance of a publicly funded collector. Dr. Scheer, you spoke earlier about the ongoing research by Canadian Blood Services into MSM policies. The new federal health minister has in her mandate to ensure non-discrimination in blood donation policies. We encourage you to work quickly with this minister to abolish any discriminatory policies that currently exist, in particular to the ban on men who have sex with men. We believe CBS needs to be well-informed of international trade agreements, and I know I've spoken about this before, and the impact that these agreements could have on plasma security. In Canada, once for-profit clinics begin to sell their plasma on the international market, it will absolutely have an impact on our security of supply. And lastly, we are pleased to see CBS write a letter in favor of pharmacare. We believe your role in advocating for the people you serve is vital. We have collected stories of transplant donors who are unable to afford their medication once they have been released from hospital. In September, a young man went 4 days without his medication after receiving a double lung transplant. Surely you have stories of patients in need of medication, and it's of the utmost importance that you share those stories with ministers and the public so that the need for expanded and universal pharmacare coverage is understood. Those who are fortunate to benefit from organ transplantations that you arrange should not have to lose their life because of the gaps in coverage for medication. I thank you in advance for your comments to this presentation, and I will send the comments in writing to Madame Chair Hollins.
Thank you very much, Adrienne. You will have heard some answers to your questions already this morning, and as I promised Kat, we will respond to you in writing as well. Graham, did you want to add anything?
Well, no, we will obviously get into the detailed response, and thank you for all of those comments, Adrienne, as before. I just want to make one comment, Madam Chair, mostly to inform members of the board, but also all members of the public. both in response to Kat's comments and Adrian's about how we commemorate. There is a beautiful maple tree planted a number of feet outside this building that was actually commemorated by James Krepner and members of the Canadian Haemophilia Society and stands as a permanent memorial to their memories and the tainted blood scandal. And we're very proud of that tree that we planted.
Thank you very much.